The idea of cancer often has us shy away from vital screenings, yet cancer awareness is the key to early detection. Promoting better health-seeking behavior and screenings, cancer awareness tremendously aids in the fight against cancer.
Cancer screenings are incredibly important to the best possible cancer treatment. Many screenings have been developed for breast, lung, colon cancer that have become much more routine. So the process of getting screening is simpler for patients.
It's important to catch breast cancer early because treatments are different at an early stage than they are at a later stage. Typically, if a cancer is caught in an earlier stage, there's less surgery needed, chemotherapy may not be needed, radiation may not be needed, but certainly catching cancer at a later stage is going to mean more aggressive treatments that are needed.
Patients really need to have a quarterback, a champion, by having a primary care doctor that can get the right screenings for their individual health needs.
So women who are at increased risk of breast cancer really should be having yearly mammogram as well as yearly MRI. We like to stagger the two so they're 6 months apart. And the reason for that is the two imaging modalities look at the breast in a different way. Mammogram is very good at seeing calcifications, also with seeing increased density or changes that could be suspicious for breast cancer in that format. MRI adds a metabolic component to it. An IV contrast is injected. The cells actually process that contrast. Cells that are more rapidly dividing or faster growing process the contrast differently than slower growing cells. And that's how we can see a cancer within the breast because it grows faster than the surrounding tissue.
As humans, we are all unique from who we are mentally to our genetic makeup. This is why it is important to have individualized, holistic treatment to ensure that you are cared for as more than just a number, but as a person.
Personalized cancer treatment has really become the standard for cancer care over the last 5 to 10 years. We are now blessed with many more genetic tests that can really target the details of what's going on in a person's body. By getting that information, the physician can know, am I giving an immunotherapy drug that's going to amplify the immune system that has a flaw in it? Or is there something genetically unique in that cancer itself that one particular drug over another can target? So it's really to get the most precise treatment that increases the odds for a better outcome, a more effective treatment, and a realistic chance at a cure or ongoing management of a patient's cancer.
So when it comes to personalized care, I think it's essential for so many reasons. One, because with every diagnosis, there are actually different plans and approaches to treat it. If you go to any number of oncologists, you're going to hear varied approaches to how to handle it, so being informed is critical. And on top of it, every person has different needs coming through it. I think you'd assume that just because somebody is in the same circumstance with the same diagnosis, same age, same gender, that it would just be a straightforward treatment. But even in those cases, there's varieties of what's needed depending on their background, depending on stage and grade and all these different elements. And so having that care is essential for that too.
Cancer treatments continue to evolve in many ways. The field moves very quickly. Some examples would include patients who have triple-negative breast cancer. We now are incorporating immunotherapy into their protocols, whereas before that didn't exist. It's very exciting to see the impact that immunotherapy has on our patients. And we are now treating high-risk women with a different option that didn't exist before, which is increasing the cure rates. Our patients are doing the best that they ever have.
In the past 5 to 10 years, many new treatment protocols have been introduced that revolutionize the way many patients are treated. Rocky Mountain Cancer Centers takes both a highly technical and compassionate approach to cancer care. With a hand-picked team of board-certified oncologists who are masters in their field, Rocky Mountain Cancer Centers offers the most advanced, vetted treatments available.
RMCC is involved in clinical research at a national level and a local level. We partner with over 50+ centers in the United States that incorporate patients in the real world. So our patients are truly on the cutting edge because science and cancer care moves probably the fastest in any medical field. You want to have access to drugs and protocols that are the wave of the future. So it's important for us to stay ahead and to offer patients the treatments of the future today.
I like to think Rocky Mountain Cancer Centers delivers cutting-edge cancer care in 3 ways. Number 1 is our doctors are very active in clinical trials, so we're bringing the latest and greatest treatments to our patients. Secondly, we try to understand where our patients are living. What are they going through? How do we help them get easier access to their care, get into the office more easily, get their treatments at home? And finally, cancer care is very complicated. It involves not only the medical part, but the psychosocial, financial part. We work with our patients on all three of those areas to provide cutting-edge cancer care.
Cancer care is a very personal and intimate experience, requiring specialists who are dedicated to caring for a patient's whole health. Rocky Mountain Cancer Centers is relentlessly dedicated to its patients, fighting alongside each patient to ensure the absolute best care possible.
Holistic care is something that we approach very seriously at RMCC. When a woman comes in and has breast cancer, there are so many options now as far as how we can surgically treat the breast that it's really important to focus on not just the anatomy of the cancer or the stage, but also what the woman wants to do. I had a young patient who was diagnosed with a relatively early stage breast cancer. And so oftentimes those younger women want mastectomies, reconstruction, all of that. This was very different. She did want mastectomies, but she wanted no reconstruction whatsoever. She was a tattoo enthusiast. She had already come up with this whole plan about how she wanted to tattoo her chest and really make this artwork on her body that would be her way of taking care of her cancer, making sure that she was doing everything she could to be around for her daughter, but turning it into something beautiful instead of something sad. So part of that whole holistic treatment is really listening to what patients want to do, how they feel about their body, and taking that into account.
RMCC, they have the tagline, exceptional people and exceptional care. And I honestly can say that's exactly what I experienced with them. They are so diligent to stay on cutting advancements. When I came to Rocky Mountain, the very first meeting I had with Dr. Mardones, she came in, she quoted the latest New England Journal of Medicine. She was up to date. She pulled out a regimen sheet and actually showed me the difference in efficacy between using this or not using it. I can genuinely say there are not words to express the depth of my gratitude, both for Rocky Mountain, the great lengths they went to get me care, and especially for Dr. Mardones.